Good morning. This is Dr. Chris Ebert Santos at Ebert Family Clinic, and it is March 5th. I have some updates about why we should still be careful, wear masks, and keep our distance, even those of us who have gotten 2 doses of vaccines, to be respectful. There were 1,300 cases of COVID last week in Colorado. So COVID. Who cares, I'm young. I'm not going to get seriously ill. However, last week we also had our first case at Ebert Family Clinic of Miss C, Multisystem Inflammatory Syndrome in children. Between May and November, there were 20 cases in Colorado, and there have been many more since then, including at least 2 deaths. This was very mysterious because many of these children were not known to have COVID until several weeks later, when they began to have very high fevers, which is the number one symptom that all the children have, and then a variety of other symptoms that are sometimes very confusing. Now, usually we really don't get very excited about kids with fevers. It's very common, it's normal, it builds up their immune system to have exposure to viruses. But at this time, where there are very few viruses circulating besides COVID, we are going to have to think of Miss C at the top of our list whenever we see a child with very high fevers. They can be also fatigued, irritable. A lot of them have GI symptoms like nausea, vomiting, diarrhea, and loss of appetite. They don't tend to have cough and respiratory symptoms, but the day that you can really recognize these children is when they develop red eyes and red rashes on their hands or feet. Then we know for sure, okay, this is it. Straight down to intensive care unit. So Miss C, it's rare. We're not going to stay awake at night worrying about our children getting it, but we're going to have this on our radar, and all medical providers will be thinking about this when they see children with fever, because it can be a very serious disease. Many of these kids are in the intensive care unit. And the other reason why you should keep wearing masks and social distance and be careful and get a vaccine if it's offered to you is this long haul syndrome, now called post-acute coronavirus syndrome. 10 to 30% of people of all ages, even healthy young adults who had very mild COVID, are plagued by months of fatigue, just bone-draining exhaustion, headaches, loss of taste or smell, and other symptoms like bone pain, joint pain, and it's extremely disabling. Brain fog is the one I fear most, because that could definitely interfere with my ability to take care of my patients in my clinic. So we just want to bring this up to you. Continue being careful to avoid contracting COVID. And for more information about the special conditions, advantages, and disadvantages of high altitude life, check out our blog, highaltitudehealth.com. You can also go to our website at Ebert Family Clinic and see all the wonderful things we are doing here. And don't hesitate to call the clinic at 668-1616 or thank you very much.